we saw that community-based research has stemmed from many reasons. Unmet needs of specific communities, ever-emerging issues about HIV, in HIV prevention and care, the need of innovation, but also this growing acknowledgement of what we call the experiential knowledge, the knowledge gained through living the difficulties and through experimenting the difficulties. All those conditions has led the researchers, the scientists, and the community people come together and make research together. But first of all, who is the community? Who are we calling the community? Actually, community is not a thing by itself. It's more a result of a social construction. It's a group of people that share common characteristics that give them a sense of identity. And I'm going to try to answer the question: why are we involving community in research? What is their added value? Well, first of all, community. People has a better knowledge of the community studied and their specific needs. That's very important. We have this wonderful research project in several countries in Africa because we wanted to understand why women are not undertaking PrEP as much as men. And of course, it's called PrEP Femme. And of course, we had to go and work with the community involved, women. People from the community will talk more freely to their peers instead of talking about some very intimate subjects like sexuality, for instance, instead of speaking to complete strangers, scientists. So, of course, this is leading to a more accurate and more comprehensive information about the field. They have a great capacity of mobilization of themselves. Perrine mentioned the RDS methodology that we can use, for instance, in the biobehavioral studies. And those studies rely completely on networks. And if you don't have the network, you don't have the research. And of course, we can also use, there are some resources, actually a lot of resources that exist already in the community, and we can put them at good use for the sake of research. Now, from the other side, why do communities would engage in research? What is bringing to the community? Well, first of all, the academic and the public validation. Research will lead to publication, to communications, like a conference today. And this, in turn, will offer a better exposure and a better recognition of their efforts. And this will lead eventually to the fact that the community is taken more seriously by policymakers and donors. And this is very, very important. And more of that, it will help the community to validate the relevance of the subject of research, of the question of the research that they have chosen, and that it is supporting their advocacy towards media and policymakers to make them understand that this issue is relevant and it is important to be addressed. Of course, communities also would engage in research because they know that this will generate a huge amount of data that will help them to achieve social transformation, which is the ultimate goal of community-based organization, isn't it? So the community research will help generate new knowledge about the community, understand their habits, their needs, their practices. Community research leads to change in individual behavior, in societal practices, even in policies. In Morocco, HIV testing was by law exclusively restricted to physicians, to MDs, not even nurses, not even to any healthcare professional. And ALCS did research with the help of scientists about an offer of the feasibility of community lay providers HIV testing, people not having any medical background, and it was a huge success. And this helped us in and supported our advocacy towards the regulations authority to change the law, and we have achieved that. It took us some years, but we did it, and today we have this community lay providers offering HIV testing everywhere in Morocco. So we can change policies. Of course, we can expand new interventions, reach new populations, and of course, we build trust. The community builds trust towards the research results, which help them buy into the findings of the research. Capacity building and quality improvement, of course. Community people engage in research will gain new skills, will gain expertise that they can carry over into other areas of their life, employment opportunities, education, improving their prospect. This is very important, and they understand that the skills they have gained, they can put them at good use for solving a lot of other determinants of their life, not only in health, but in a lot of other areas in their own life, helping them taking control of their own life. And this is what we call activism, actually. This is activism, and this is where it can comes from. Community research also helps us raising standards and engage in quality schemes, in quality improvement. Like when you do research, good research, you have to write down everything. You have to have a very stringent protocols. You have to write the standard operating procedures for everything. And Bruno Spiro was mentioning in a conversation earlier how in ANRS Comtest, the project studying the feasibility of HIV testing by lay providers, they had to write every SOP of HIV testing and how they engage in quality improvement. And this is crucial. And last but not least, on a more personal stand, the community research is helping in personal development and positive self-improvement of the community people. It will help them grow their self-esteem. We tend to see sometimes that community members, we tend to think that they are more disadvantaged in comparison with scientists, maybe economically, maybe educationally, and in other ways. And doing research, and also because community research is breaking down barriers, class barriers, racial barriers, economical barriers, and everyone is treated the same. Because of that, the community members, they grow their self-esteem, and this is leading towards a very positive social change. So in conclusion, community-based research is a win-win process for both sides, of course. It is a long-term commitment because it takes a hard work, a long work. It is not one shot and it is done. It will, of course, as we have seen, produce the best and most accurate information possible at the time where it is done because of all the reason we mentioned. And ultimately, it is going to empowering the community and then leading to a social change. And social change is the absolutely ultimate goal of community-based organization. And thank you very much.